All right. Let's good morning everyone. Good morning. Jim, I know you are always here, try to be here. Um so hopefully the weather will get better soon in North Carolina. All right. Thank you for coming to today's live stream. So let's do a little bit different things today or this week. So let's talk about something more local but potentially serious. So if you follow a little bit on the news, you would have known that this respiratory disease that I'm referring to is whooping cough. Okay, whooping cough. Now there's a more formal name for whooping cough, which is Pertussis. Pertussis. Cases in New York City have shot up by 169%. Now, if you're not in New York City, this perhaps may not affect you directly, but that is still something of concern. I'm going to break it down for you and why this might be happening, and let's tie to some of the recent events in the New York City, and most importantly, what you can do to stay safe. So let's jump in here. Let me pull up the slides. So now let's start with some of the basics first. Right now, this year, like I said at the beginning, we've seen more pertussis cases than usual, 169% more this year compared to last. And now you may be thinking, why this is all happening all of a sudden? Usually we don't hear pertussis very often. One reason is could be low vaccination rate. Now, I will get back to this area. What is this pertussis vaccinations and how safe are they? Is it okay? Right? Now, there's low vaccination rate in certain areas. Most of us got vaccinated for pertussis without too much of our awareness. I'll also tell you why. Now, the fact is that if there are fewer people that are vaccinated with pertussis, it's way easier for any contagious diseases like this one to spread. And there is a very important factor here. Now, since 2022, it's about 2 years ago, New York City has welcomed over 200 migrants. Now, many of them are living in crowded shelter. Now, the latest statistics I can find is that there's still some 60 some thousands of them are in shelters. And imagine how fast germs can spread in places where are more packed together. And plus, a lot of these folks might not have had access of to this particular vaccine before arriving, which just add to the problem. Now, so what exactly is pertussis? And you may have heard of them a lot of time. Is whooping cough. What is the detail of it? Right. Let's get to it. Now, the bacteria that is causing pertussis. So this is a bacterial disease. So not a viral disease that commonly a lot of these common cough, cold, it's all virus, but this one is particularly bacteria. There's a fancy name to it, Bordetella pertussis, and because of that pertussis, they use that name for the disease as well. Now, it could get pretty nasty. This bacteria gets into the respiratory system through droplets. Because it's a bacteria, it just doesn't float very well, okay, in the air. But when it's in the droplet, get exposed to it, you will cause one heck of a cough. Now, I'm talking about cough that it just um, cannot stop. Very strong cough, grasping for air, making it the weird whooping sound. That's why it comes with the name whooping cough. So what's happening after this bacteria gets into your body? So once you get pertussis, the bacteria actually releases toxins, right, that paralyze tiny hairs. They call it cilia along your respiratory tract. Now, these tiny hairs usually help to clear out mucus. It sweep up and you just cough it up those mucus. Now, but when the cilia is not working and you continues to breathe, there's particles and things like that that traps into throat, and also mucus starting to build up. Like all these common cold situation, you get more irritations, and that's why it causes this cough. And because of the the paralyze, okay, of these cilia, it just stops the movements completely, and so that gets pretty bad in some cases. Now, for adults that with strong immune systems, you get exposed to this bacteria, the problems more time is more self-limiting and it's not as severe. But for babies, older folks, or other immunocompromised patients, the immune system aren't as strong, so they ended up can get really serious complications. And the problem is not solely because of this particular bacteria, but other situations. When you have a mucus build up there, it won't be able to sweep up, and you get other bacteria that you breathe in, or viruses that you breathe in. It can lead to like more serious, like deeper infiltrations of infections get to the alveoli, the air sac of the lung, that can cause pneumonia. So that would be more of a bigger problem. So that's one thing lead to another. So how do we treat whooping cough? Now, if someone get whooping cough, good news is it's a bacteria infections. We have antibiotics like azithromycin. You may have heard of it, but you may not. But in the U.S., this drug is oftentimes packaged in a pre-packaged, pre-dose package for 5 days. We call it Z-Pack. And if you catch it early, you can take this antibiotics, although it is not directly approved for that, but it's shown to be effective. So doctors have been using that for some time now. So you take this antibiotics, and if you finish the course of the treatment, you slowly get better. Right? It won't stop the cough right away, but it'll slowly get better. Now, but talk about it. The most better way to prevent, although not to treat pertussis, most better way to avoid it is to prevent, and it has been quite effective. In as a matter of fact. Now, pertussis vaccine. So this vaccines is old school, like very old school. The disease causing bacteria was identified in 1906, and for over 100 years, there has been a vaccines that's been developed for this particular bacteria. Now, at first, in 1920s, it's just using the whole bacteria cell. So okay, you kill the whole bacteria, package it, clean it, package it, and inject it to the body. The problem with that is it's whole bacteria. It's relatively like large. It causes a lot of reaction site problem, and also lead to more fever. So by 1940s, now still the same vaccines, but instead of just giving it alone, they started to combine it with diphtheria and tetanus in a single shot. And that's why you usually these days you never get pertussis vaccine, but always in a combination. Now, 1990s, there's something better happening. So happened at the time. Because the whole bacteria is causing so much side effects, so they take out the pieces and parts of the bacteria, like proteins or lipids and other components, and formulate it into a vaccine, and it showed to be equally as effective and way less side effects. Now, nowadays, for kids very young, they shortly after they're born or a little bit slightly older, they get this called DTaP vaccines, right? DTaP vaccine. So the D stand for diphtheria, T stand for tetanus, and AP means acellular, means like without cell component, uh, pertussis vaccines. And as we grow up, and we get this very confusing name. It's called Tdap. Okay, they switch the alphabet a little bit. So a lot of the time when we are adult, and when we are doing a lot of yard work, people working in constructions, that have an increased chance of getting hurt in the field, okay, in the wild, or like maybe rusted, metals and all these. We usually suggest people to get this tetanus shot every 10 years, like a booster. And this tetanus shot, you don't get it alone, so it's always along with other things. So that's why you get this pertussis vaccines without too much of awareness. Usually, most people aiming for that tetanus protections, right? So Now, so here comes to the tough topic and tough things that I want to say that, to address. Now, some experts believe that surges in pertussis could be tied to a large number of migrants arriving in New York City. Now, I say some experts because these days everything can be politics, and depending on what type of a news source that you go to. Now, I do read, either side of it, and some people try to really avoid drawing any conclusion, and that is true in part that there's no solid evidence saying this and this or something together. On the other hand, there are also references, there are also parallel things that happening in Europe or has been happening in Europe that can draw some conclusion to it. Now, here is a article that I pulled, fairly recent, that was by European, I think it should be precise, it's Italian researchers that have been confirmed that migrants that have been moving to it, Italy in the last few years had a lower vaccination rate, and it is often also true, okay, for people that are coming to the US in the last few years. Now, combined with crowded living space, this is just like a kind of storm that is perfect for infectious disease like pertussis to spread. Now, here is the thing. It's not about blaming anyone. All right. The key here is to be aware of pertussis, and it is very preventable in a sense. Now, I know the public, have perceptions for vaccinations has changed a whole lot in the last few years. But when a vaccine has a track record of long-term safety and effectiveness, I think we should consider them rationally. So that is the message I really want to bring forth today and this week. Now, so thank you very much. Not a lot of you watching it live, but thank you for those of you that are watching it live, especially those that are, always here. Um, so if you have any questions, drop it in the comments, or you can always write it here that I can answer it right away. I like to, just to catch up with you all. So let me know if you want me to do more of these weekly coverage of some of the current ongoing public health topics as well. And if you find this helpful, like and share this video, and thank you very much. Jim, okay, I saw you here. Yes, yeah, okay. Yeah, your daughters and family live in New York City. Thank you for telling me. Yeah, New York City can be crowded. My parents live in New York City as well, and was just in New York City yesterday. I was just went to visit them yesterday, and it's crowded like usual, and it's even more crowded. I think yesterday there was a Yankee game, not Yankee game, a game in the Yankee Stadium. So as I wish to say, and I went in. I live in Pennsylvania, so I drove, into the bridge, into the city, and it was super crowded. It took me 4 hours to get to New York City, get inside instead of like about 2.5 normally. So that's definitely New York City. It's more crowded than ever now. So something to be aware. That's what I would like to tell everybody. Okay, thank you, Jim. Yes, I'll try to be, up to date with current public health things as much as possible. These days, I do have to admit that I'm working a lot less on YouTube topics now, and as we are really moving out from the pandemic time, but I do still want to keep up with those of you that like my talk and like the channel. Thank you, Skywalk Trace as well. Okay, thank you very much. Yeah, that is all for this week. Just a side note, it's not related to any health things. I do have other video interest, and I do sometimes I do a lot more travel these days. So I just went to Denver, and did a lot of these like travel videos. If you care to learn more about me personally, behind the science things, then there's also my channel just branded under my name, my full name, and have some casual things to post. All right. Thank you again for tuning in. I'll catch up again next time, and have a nice rest of the day and or evening or whatever time you're watching. All right. Thank you, Jim. Take care. Take good care, everybody. Bye.